Hello, and welcome back to the 501c TV podcast, brought to you in collaboration with Nonprofits First. I'm your host, Jenell, and we are here to talk about the impact, stories, and leadership behind all of our wonderful, amazing nonprofits here in Palm Beach County. And I'm very excited to have with me today Elizabeth Burrows. Hello, Elizabeth.
Hello.
She's the Director of Development and Community Relations for 211 Palm Beach Treasure Coast. So I'm so excited to have you here today.
I'm excited to be here.
So let's get started. So tell me a little bit about how you got connected with 211 and your whole background in the nonprofits. Let's start there.
Oh, my background in nonprofits. I've basically been doing my whole career in either the public sector or nonprofit sector.
Yep.
So I would say I'm a professional helper.
Yes, I love that.
Yeah. So no one, I think, is surprised that I landed at 211. Sure. I've been a fan of mental health work. I would consider myself an advocate of mental health work. But I also think that it's been so fulfilling to use the gifts and skills that I've cultivated in my career doing marketing and doing grants administration and all kinds of things like that, raising money and really raising community support and engagement for different causes to bring all of that to 211. So I'm doing a lot of the same things I've done in different municipal organizations and nonprofits, but here at 211.
You just keep building on all of your expertise, and here we are. So I'm obviously familiar with 211, but if you can just give us a background on who 211 is, and then, kind of the structure, because there's specifically you're with Palm Beach Treasure Coast. So
yes.
Give us the background on 211.
Yeah, and thank you for that question, because I think everyone should know how 211s work.
Yes,
so
it's important.
It
makes a big difference.
It does. So the first thing you should know is that the FCC designated 211 as a national line that you can call anywhere in the U.S. to get connected to what they call information and referral services or community resources. So anywhere in the country you go, you can dial 211 and get connected to a center, an organization that answers that line.
Perfect.
And so that's a national network, but that national network is answered locally by independently operated centers. And so 211 Palm Beach and Treasure Coast is our regional agency that answers calls in the Palm Beach, Martin County, St. Lucie, Indian River, and Okeechobee County area.
Oh, that's a big area.
It is a big area.
It's a big area.
So there's over 2 million residents living in those 5 counties. So we have the pleasure and the responsibility of serving about 10% of Florida's population.
Yeah. That is crazy if you think about it like that, just in that corridor.
Yep.
And then it goes south, right?
Yeah.
So then there's a whole nother little section that covers
to the south of us, 211 Broward steps in. To the north of us, I think 211 Brevard is the north.
And that's there's the further north.
Lots of other 211s in the state of Florida. And we all are friends.
Yeah.
We all work together, collaborate. So there's a statewide network of 211s that gets together to make sure that we're all sharing information and resources and advocating for the needs of the 211 network as well.
That's amazing. So what is kind of the core mission of 211 Palm Beach Treasure Coast?
Yeah, our core mission is to help people who are in crisis, to help them connect to wellness resources and mental health resources.
Okay.
And we're best known for our core program, which is the 211 helpline. So when you dial 211, you get the 211 helpline. So we've got a team of folks who are answering those calls 24/7 every day of the year.
When did they set up the 211 line?
Fabulous. So it's interesting, and that seems like it would be a simple question, but it's actually a little complicated. Because
I love the background on. I love learning the story, the how and the why.
The story.
Perfect. Good. You're in the right place.
Yes. So our organization was started as a nonprofit before the 211 line came into existence. So we were founded in 1971.
Wow.
Yes, so we're actually celebrating 55 years of serving Palm Beach County this year.
That's awesome.
It's fantastic.
Okay.
But we started really as a drug abuse hotline.
Okay.
Yes, and it was all volunteer run at that time. That hotline grew very quickly into offering suicide prevention services.
Sure.
And then About 10 years later, we added in the information and referral services thanks to some great support from the United Way of Palm Beach County.
Yes.
Made that possible. And it was, I think, in 2001 when we got designated to answer the 211 line.
That's pretty cool.
Yeah.
So is that like how organically a lot of the 211 individual kind of centers come to be?
You know,
Or
I think every community has its own journey,
That's
has its own
interesting.
story.
I
Yeah,
did
I
not know
think
that.
there are definitely 211 centers that came into existence after the 211
Sure,
line was
just
designated.
specifically for that
And then there are
purpose.
others like us who
Yeah.
there are organizations that have been serving people in crisis or just
Right.
serving people to connect them to resources, again, before that 3-digit dialing was a
Right.
thing.
And then it just morphed into that
Yeah.
naturally. That's so cool. I love that. So what happens when somebody dials 211?
Yeah.
What happens?
So the very first thing that happens is you get a prompt that asks you what language you speak,
Mhm.
English, Spanish, Creole. And so if you speak a different language, you can connect to one of our specialists that
Awesome.
we employ a multilingual
Yeah,
staff
that's so cool.
for that very reason. Then you also get a prompt to say whether or not you're in crisis. So if you are in crisis, then you'll dial that number, and that actually gets your call prioritized to be answered sooner, so that we're responding to folks who are in crisis sooner, because when you're in crisis, every second matters.
Sure, absolutely.
Yeah.
Okay, that's so cool. And you know, the people that are reaching out on the line, what types of needs or challenges are they facing at that time typically?
Literally everything under the sun. So we get all kinds of questions and requests. Our specialists. So we've got
How many people are there on the line
that's
at
a
any
great
given
question.
time?
Yeah. So it varies because there are peaks
I'm sure.
and valleys to,
Yeah.
trends for when people tend to call in most frequently. So I would say weekdays
Sure.
are busier than weekends, but I would also say that the late hours of the night and weekends, we are more likely to get crisis calls,
Yeah,
even
makes
though
sense.
we get fewer calls.
Sure.
So yeah, so we staff accordingly based on demand
Right.
because we want to make sure that we're able to respond to every single request for
Right.
help in a timely and efficient manner. But we employ a team of about 30 specialists right now who are answering those calls on, the different shifts 7 days a week.
That's so
24
cool.
hours a day.
Oh my gosh. And I would think like the training that goes into that, I can't even like imagine.
In a word, comprehensive.
Yes. I
Yeah.
mean, I can't imagine, you don't know. You pick the phone up, it's something different every single time.
Yeah, and I would say I have so much respect for the specialists
Yes.
who are the ones on the front line serving people, because they have to be not only trained but emotionally prepared
Yes.
to respond to whatever it is that is on the line when they answer. And so those calls can range from, something heavy, but not necessarily a crisis. Like someone might call to say, my car broke down and I don't have a way to get to work.
Sure.
I've looked around and my family can't loan me anything. If I miss one more day of work, I'm going to lose my job.
Right.
And that's an important call to take.
Yeah.
But it's a personal crisis. But the person calling in might not identify that as a crisis situation, but just as them needing help.
Sure.
But then we also get calls from folks who are experiencing things that are much more serious, like a mental health crisis.
Yes.
And they are having thoughts of self-harm, or, they are having thoughts of suicide.
Right.
And those are incredibly important and critical moments where connecting someone to someone who's trained to de-escalate that
Correct.
situation
And keep them on
help them feel
and-
supported
Yes.
and make sure that they're not alone.
Yes.
Can make all the difference.
Right.
Absolutely.
I love that. So what do you think makes 211 different from a lot of the other kind of crisis organizations that are out there?
Yeah. Well, first I'll say there are so many crisis organizations, so many partners doing this work because there's such a need for it.
Yes.
And none of us can do this work by ourselves.
Totally, yeah.
So we consider ourselves as being part of an ecosystem of support. There's a continuum of care that our community needs
Sure.
if we're going to be resilient.
Mhm.
And our role is, we have a couple of different roles, but kind of in this continuum of care, we're here to, I've heard some folks explain it as being the emergency room sort of for folks in crisis.
Yeah.
So you know how if you
have to like triage them, right?
exactly,
Yes.
triage is the perfect word.
Yes.
So
Totally what I was thinking when you were going there. I'm like, that's
something happens,
Yes.
folks need help, they don't know exactly where to go, what kind of help they need.
right.
They can call 211 and we will assess them.
Mhm.
We will ask questions. We will get to the bottom of what all of their needs are, and then we'll connect them to resources
Right.
so that they can get served. So we de-escalate, we make sure they're okay in that moment,
Mhm.
and then we connect them to a partner where they can get ongoing support. So
Right.
that's our role. So we're kind of that front door for a lot of folks who need resources. We might be the first call that they make,
Sure.
or sometimes we're kind of a side door. They've made lots of phone calls, they've had lots of conversations, and they haven't gotten where, you know, they want to be. And so they call 211 frustrated, overwhelmed, confused
Yeah.
because there's so many different things out there,
Yes.
and trying to wade through it alone can be overwhelming.
Totally. That was the other thing I was thinking is like sometimes there's like an overabundance of information and
And it's not all good either.
right. Yeah, it can be
Yeah.
confusing and
Mhm.
you're just like I don't know what I need or where I need to go.
Yeah.
So that's really cool. I think you guys are super unique in that fact. And
Yeah.
I mean, if you had to guess, how many partners, agencies do you guys work with?
I don't have to guess. I can tell you.
How many?
We are partnered with about 1,600
That's
agencies
unbelievable.
across our region who collectively offer over 5,000 different programs and services.
Yeah.
Yeah.
Which is, if you think about that number, I mean, wow, that's a lot of resources
It is a lot of
just for our
resources
area.
just for our area. Yeah.
And it's a great thing. Like I always say, like Palm Beach County has the best nonprofit world, and there's just so many people, everyone's out there trying to do
Yeah.
the same things, but you guys are all working together,
Yes.
which is awesome. And I really feel like 211 is like that United Way you mentioned. They're
Yeah.
the same way. It's about bringing the right resources to the the right person at the right time.
Yes. Something I think that's really important to note is that, like you said, Palm Beach County especially has
Mhm.
such a rich nonprofit community.
Yes.
There are so many people who care, so many people serving different causes, trying to do good work. But we also have lots of smaller organizations that serve a very small segment of the community, a small
Correct.
population. And so if you're a person who has a need and you're just looking for an organization to help you with the problem that you have, the challenge that you have, trying
Sure.
to find the right organization that has resources in that moment based on where you
Yes.
are and what you need, can be really, really daunting.
Right.
And most folks will start with, a search on Google, right?
Yeah.
And Google information, it does not help you very
No.
quickly to sort through eligibility requirements, wait lists, registration processes, all of those things.
Can be
Whereas,
frustrating
and
too.
that's really how 211 is helpful. If you call 211, actually, you don't even just have to call. You can text.
Really?
You can
Oh,
email.
that's
You can
even
chat
better.
online with our
That's cool.
team. And it's always a live person in our organization. We don't outsource those contacts, so it's always our team.
Yeah.
But our specialists are trained to search our database to find the most relevant resources for the
Right.
person that they're talking to.
Which is awesome.
So we're better than Google in that way.
Yeah, exactly. I would be like so overwhelmed if I had to, deal with just a Google search on anything.
Yeah.
Can you share with us a story that to you highlights, the real impact that 211 has either on an individual or a family? Just a good story that
Sure.
you like.
There are so many
I know.
stories. There's so many stories
Hundreds.
I could turn to. Um, so something that not everyone realizes, we have our core program, the 211 Healthline,
Mhm.
but we also have a couple of different internal advocacy programs.
Okay.
So there are certain populations that are more vulnerable. They're more likely to
Mhm.
experience crisis. So folks like seniors, children with special needs, our veterans, they are at risk for more crisis situations and sometimes very complex crisis situations. And
Got
so we have programs to really help people connect to those resources in a more specialized way. So one of my favorite programs that we operate is called the Sunshine Telephone Reassurance Program. It's a mouthful.
It is.
It's a mouthful.
But I like sunshine.
Sunshine is great.
Yeah.
So we make, through the Sunshine Program, over 500 calls every day to isolated and homebound seniors throughout our region who might not talk to anyone else over the course of a day.
Yeah.
So there are so many seniors in the area that don't have family nearby, or they have family nearby, but they don't have an easy time getting around. And so it might be several days before someone comes to check on them. And so we offer them a daily call as a point of social connection and to brighten their day.
That actually makes me so happy.
It is.
That's a great program.
And then it also doubles as a wellness check. So those Sunshine clients, they schedule the time that they prefer their calls. And so if they don't answer their scheduled call after multiple attempts, we get someone to check on them. Sometimes it's a wellness check. And through that program, we've been able to make so many life-saving interventions.
I bet, yeah.
So the stories that come out of that program are so touching.
You would probably have me crying if we sat here. And
that is usually the reaction.
We talked about it for over an hour.
Yeah, it's the best. And part of what makes that program so special is that that program is largely run by volunteers.
I was going to say, like, how sweet would that be? That's such a great way to volunteer and give back.
It's a great way to give back.
So easy and just meaningful.
And it's immediately impactful.
Yeah, that's amazing. In the community, what are some of the most urgent needs that you guys are seeing now? And I'm sure this could change on a yearly basis or even probably monthly, but currently, where are we at? What are we seeing?
It does change from year to year, but there are some that are always floating around at the top. So mental health and substance use disorder is always at the top. So we're pretty proud of that because it means that people know to reach out to us when they're experiencing a crisis. So we do lots of help that way. The number 2 issue regionally, and I'm sure this comes as no surprise to anyone, housing.
Yeah.
It's really big right now.
Yeah.
And then, it's unsurprising. The cost of living is going up. There's less housing available compared to the demand for it. And folks are moving around quite a bit. And so housing, folks need help with housing, accessing it, leaving quickly, the affordability changes, all kinds of things. And then very closely related, probably also unsurprising, we get lots of requests for utility assistance. So during financial hardship, you keep paying the rent, but maybe you don't pay the light bill on time or your water bill, and you're trying to avoid a shutoff. So lots of situations like that. Lately, food is another very top concern. It's getting increasingly difficult for folks to keep the amount of food that they need to feed their families in their kitchens, on their tables. And so fortunately, we have lots of organizations across the regions that can help with that. So we're able to provide people lots of resources for that. Something that sometimes is big and sometimes is less of a need, healthcare. So that's something that spikes, but it's still a pretty popular need right now. And transportation is another that comes up
really
often.
That's one that I actually am not surprised by, but it's just something I wouldn't have thought, but makes total sense. Yeah, that's interesting. So what role specifically would you say 211 plays in, like mental health and mental health support and like specifically like intervention? So what does that look like for you guys?
That's a great question. Actually, I would say one of the most important roles that we play is in suicide prevention. So I don't think I've said this yet, but in addition to answering the 211 line, we also answer regional calls to the 988 Suicide and Crisis Lifeline.
Interesting.
Our team does that as well.
I actually just learned that today in another interview about that call, about that number. So that's interesting. Okay, cool.
So essentially, no matter what kind of help you need, help is just 3 digits away on your phone, 211, 988.
Thankfully.
You can get served, but there are so many people who are at different phases of needing help. We're also able to help lots of people who are calling because they're concerned about someone that they care about.
Right.
They want to know, what are the warning signs? I think someone is struggling.
Sure.
How can I help? And so our team is there. And that's one of the most crucial roles that we can play, is being there when people are struggling through their darkest moments and they
Sure.
feel the most alone, making sure that they know that we are always here. We will always answer.
Yes.
And you can get through this and stay.
Right.
And then also just helping to equip our community to be a part of that resilience, to be a part of that support. So we've been offering for maybe the last 2 years a suicide prevention training course for the community.
That's
So
actually really
we can
smart.
get more people trained up, not to do what we do, but to be kind of part of that initial first line of defense,
Yeah, and
to
just to
get
be,
people connected to help when they notice that help
and
is
also,
needed.
yeah, just to be vigilant on it and
Exactly.
know, the signs or what to look for.
Yeah.
That's important.
Yeah.
'Cause-
And the more we have these conversations, the more the stigma is reduced around mental health support,
Yes.
which means more people feel like asking for help is a viable option. They
Totally.
think, okay, I need help. I don't have to do this alone. It's
Correct.
not shameful that I'm struggling.
Correct.
And there are many issues, many of those mental health crises that can be overcome with one touch point,
Sure.
with help delivered in the right moment from a
Mhm.
trained specialist can make all the difference.
Yeah, that's huge. So aside from the 211 hotline,
Mhm.
what kind of, like, I'll call it like offline, what kind of other services do you guys offer outside of just the hotline?
Yeah, so we talked about the Sunshine Program
Yes.
already. So those are outbound calls that we make
Mhm.
to seniors in need. We also have a program for veterans, so our My Florida Vet program.
Awesome.
So with that program, we're doing care coordination and crisis support for veterans, and that support is delivered by veterans who have been trained.
Oh, see, that's so cool.
Yeah, so sometimes, our veterans and first responders, they have very unique experiences.
Yes.
And there are also lots of resources that are uniquely positioned to serve them. And it can be very difficult to get them help in a way that they will receive and that they can trust. And
Yeah.
so that program is a big part of that. So we've got teams who are working, again, 24 hours a day, around the clock, every day, to connect veterans to support.
I love that.
We do free developmental screenings for children ages 0 to 8.
Oh, that's awesome.
Yeah.
Where do you do those?
Those can happen by phone, but
Okay.
parents can also go online and take those assessments online
That's
and then get
awesome.
the results from one of our team members. Yeah.
That's awesome.
And that's a really important resource because if a child is not meeting some of their developmental milestones, whether it's physically or social,
Sure.
emotionally, with language development, getting intervention early enough can get them back on track.
Totally.
So sometimes things that are challenges early on, just with the right level of support, don't have to be lifelong challenges
Yeah.
that our children take into the rest of their lives.
I
And so
love
that's
that.
another program.
That's amazing.
Yeah.
How and so, because you guys are working with all of these other agencies in the community, how do you guys collaborate? What does that look like? And, like, how do you even, like, begin to manage that and collaborate?
Well, I'm always looking for more ways to collaborate.
No, it's like I'm like, it's a big job.
Yeah, because the need is so great.
Yeah.
And because of the nature of our work, there's no such thing as being finished with it.
Sure.
So we're always looking for more partners to bring into the fold. We're always looking for more resources that we can connect people to.
Right.
And we're always looking for ways to remind people that we're here,
Mhm.
because just because you're not in crisis right now, just because you don't have a need right now, doesn't
Right.
mean you won't. At some point, crisis comes for us all.
Sure.
And crisis looks different for everyone, but people from every single walk of life experience crisis. So we work very closely with our public agencies and partners. So
Mhm.
our counties in our area, our counties in our area, our municipalities, our
Mhm.
cities and towns. We actually have great partnerships with the Children's Services Councils in
Okay.
our region. So in Palm Beach
That's
County,
huge. Yeah.
they're a major partner. In St. Lucie County, Okeechobee County even, they're great partners because supporting children and families with this work is critical to success.
Sure.
And we have statewide partners as well. So just working with public agencies, actually public safety
Oh,
units.
yeah, that
So
makes
police and
sense.
fire,
Yeah.
they're amazing
They're on the front
partners.
lines. I mean, they probably
Exactly.
they see a lot of that firsthand.
Exactly. So,
Makes sense.
and well, another important part of collaboration is the agencies that we refer people to. So the agencies that are in our database,
Yes.
those 1,600 agencies, they also refer people to call 211 so that they can focus on delivering the service that they have.
Gotcha.
And when one of their clients has a need that they're not equipped to address, they say, just call 211 and get help.
That's awesome.
Yeah.
So it's just like an open line back and forth,
Exactly.
which it makes total sense. What are some of the common misconceptions about 211 that you want to clear up?
Sure. So a question that's been coming up a little bit more recently is whether or not we're using any AI chatbots
Got it.
or, AI voices answering the phones.
Sure.
And the answer is no. All of our online chats, our emails, the text messages, the phone calls are answered and served by real live humans that are working out of 211.
Right.
Yeah.
That would be a valid thing. I mean, I get where people would wonder
Yeah.
that. There's so much AI now.
Yeah.
It's everywhere.
And of course, we're using technology
Yes.
to augment the way we work and enhance our efficiency.
Right.
But there's something about having a live human, a real human there to make that connection and also to make those judgments about what kind of help is needed
Yes.
that so far AI can't touch.
No.
Yeah.
You need another person on the line for that one.
Yeah.
Yeah.
I think another misconception would be how we use volunteers. So
Okay.
another question we get all the time is who answers the phone? Are they volunteers? Are they paid staff? And the answer is they're paid staff.
Yes.
Because our training process, it's so comprehensive.
Right.
It would take volunteers a very long time to make it through our training
I
process.
couldn't even imagine.
Yeah. And we're using actually really sophisticated technology, not just to answer the lines, but to find resources, to track high-level demographic information about needs and what we're
Sure.
seeing in call volume that it really takes a paid specialist that's been trained in what
Right.
we do and the way we do it
Yeah.
to work efficiently.
And doing that every day.
Every day,
Not,
yeah.
all day long.
Yeah.
Yeah, I totally get it. Makes total sense.
Yeah.
How can individuals better prepare themselves or their families by knowing about 211 ahead of time?
That's so good. I highly recommend that everyone follows us on social media.
Yes.
So we are on Facebook, we're on Instagram, we are on YouTube. We have a YouTube channel.
Oh, cool. I did not know that.
Yeah, we're starting to put a little bit
Good.
more content out there.
That's awesome.
So I would say follow us in all those places so that we show up in your feed and you'll get reminded. You don't have to go looking for us. We'll show up and tell you that
awesome.
we're here to help. But I would also just encourage people to remember the numbers, just like, to call 911 if your house is on fire or, if you're having a medical emergency, remember that you can call 211. If it's not 911, it's 211.
Right. Yeah. Easy
Yeah.
enough. Easy enough to remember that. Let's talk a little bit about like events and community engagement.
The fun
Your
stuff.
favorite, the fun stuff. I know you guys are involved in a lot of community initiatives, but let's talk about some of the events that you do, maybe some that are coming up that I can make sure everyone's aware of.
So I will actually say the big event that is on my mind right now is we are getting ready to break ground on the construction of our brand new headquarters facility.
Really?
We are.
Oh my gosh, that's exciting.
We are.
Where?
So actually next month, so we are headquartered in Lantana and the actual location is private because of the nature of the work that we do. But we own our campus. And so we've been operating for the last several decades out of a building that has reached its useful life.
Got you. It's time to just turn the lights off and move to a new facility.
It said it's time. It let us go, so we're letting it go.
Oh, nice.
So we're literally in the process of demolishing that building right now. And on
Cool.
Wednesday, May 6th, we're having a groundbreaking ceremony that we're inviting our donors
Yeah, good for you guys.
and our key supporters. And we're very excited about that. That's a very big deal for us. So it's going to be a 12,000 square foot facility,
Wow.
which means we'll have space to serve the community for years to come, space for all of the specialists that we need to continue serving and meeting the growing demand. We have space for all of our programs, staff. with our old building, we had actually outgrown it.
I'm sure, yeah.
We had we may or may not have transformed some closets into workspaces. We may or may not have put more than one person into
you do what you have to do.
Exactly. So we're very excited about that.
That's great.
But also providing our team, who's doing really hard work, a comfortable place.
Right.
And a safe place that's storm hardened, so that we can be there and weather the storms as we help the community weather the storm.
That's amazing.
Yeah,
I love that.
Yeah.
And do you guys do any like fundraising? Do you have to do a lot of fundraising?
So a lot of our, I would say, day-to-day fundraising just comes from people who feel compelled to support our mission. And so they reach out to us and we graciously accept their donations. If you're interested, you can always contact me. So I'll be happy to tell you how you can support us.
Yes, and thank you.
Or you can also visit our website and click the donate button, and that works as well.
Wonderful.
But our major fundraiser event is our annual spring celebration. So we actually just had that on May 7th.
Oh, okay.
Yep. It was, excuse me,
nope.
I said May 7th.
You said May 7th. We just had that.
So we just had it on March 7th.
Got it.
That was at the Colony Hotel. It was fantastic. So it's great.
That's so cute.
We had 150 supporters who were all champions of our mission, and that is our primary fundraiser. We sometimes have a fall event, so be on the lookout for that information.
Follow you online.
But certainly, I would say, get on our email list so that you get the information for the 2027 spring event, because we'll be announcing that soon.
That's awesome.
Yeah.
So we talked a lot about like partnerships and, working together. Let's talk specifically about Nonprofits First.
Yes.
So how does that partnership work, and, specific to 211, and why do you feel like that makes you guys just stronger all around?
Yeah. So one thing that is so important is that we are accredited by Nonprofits First. And we actually have the excellence level accreditation.
Oh, good for you.
We're very proud of the work that we've done. But that accreditation, having that support of Nonprofits First, having those standards to hold up has actually been really instrumental in showing our funders and our major institutional partners that we are taking our work as nonprofits very seriously, that we're governing ourselves in a responsible way, that we are good financial stewards of the dollars that we raise.
Yeah.
And it's actually very important. So we hold 3 accreditations, and Nonprofits First is one of them, and it's very important to us.
That's awesome.
Yeah. But Nonprofits First is also a great partner in terms of referrals. So Nonprofits First is, well, I'll just say, I love the educational programs that Nonprofits First puts together. I know I've been to some courses on fundraising that have been really amazing. There have been great connections that I've been able to make professionally there. And I've been able to make sure that 211 stays in front of some of our nonprofit partners who should be a part of our resource database. And that's always helpful.
Yeah, I just love it. We always talk about it, just the collaborative nature of, everything that you guys are doing, and so many of the other nonprofits that are out there. It's all kind of working, towards the same goals a lot of the time. So I love that you guys can have a space to collaborate and, and bring your resources together. And it's all for the greater good of the mission. So if there's one thing that you would want listeners to take away from this whole conversation today, what would that be?
I really just want everyone to know that you're not alone, no matter what your need is, no matter what challenge you're facing, whether it's an everyday challenge and it just feels like it's too much, or it's a major crisis situation. 211 is here. We offer our services for free, so there's never a charge for anything that we do. And it's confidential. So you have nothing to lose by reaching out for help, and potentially everything to gain.
I love it. And leave us with, before we have to go, like a good story. So what's something great that's happened, that maybe a call came in, just somebody that you remember, or a family, even whoever, that came through that stays with you?
So there are so many, but one that sticks into my mind, we got a call from a young lady who had gotten displaced from her home.
Mm-hmm.
She had lost her job, lost her home, and she had started living in her car. And she didn't know how much longer she was going to be living in her car. And we were working to connect her with some housing resources. But she called because she wasn't looking for help for herself. She was worried about her dog.
Oh my gosh, I hear that so often.
Yep.
Like, yes.
Yep. That was actually
Sweet.
what cued her into the fact that she needed to ask for
Right.
help. She couldn't figure out how she was going to feed her dog, and her dog wasn't just a pet, right?
Right.
It's a family
Yeah,
member.
it's a family member.
And so we were able to connect her to some resources to make sure that she actually got access to a housing program and access to, there are plenty of nonprofits that are here to
Yes.
support people with their fur babies. So
Yes.
that was just a really touching story because it's not something that a lot of people call in to ask for,
Right.
but it's so incredibly touching and it's so incredibly powerful. And she felt so much more hopeful just getting some good news.
Yeah,
Yeah.
that's great. I love it. Oh, well, thank you so much for joining us here today.
So glad to be here.
It was great having you, and we're out of time. So I appreciate you joining us.
I'll have to come back again.
You will have to come back again. I'm sure there'll be a million more wonderful things that you guys are doing.
Yeah.
So thank you so much.
Thanks for having
And
me.
thank you for joining us again here with 501c TV and Nonprofits First. And we'll see you next time. Thank you.